everybody. We have started recording now, and I just want to give you a really warm welcome to all of you. So this is the Scottish Improvement Leader Programme, and this programme is brought to you by NHS Education for Scotland. So we've got our colleague on the call, David Maxwell, the Scottish Government, and Healthcare Improvement Scotland, in partnership with Improvement Cymru as well. So welcome to our first module, which is structured to give you an overview and a bit of orientation to the programme as well. So we're your hosts for the session today and key contacts for the duration of the ScIL programme. We'll do a little bit of introduction in a bit in terms of all the faculty. But I'm Dominic Bird, or Dom Bird, it's a lot easier, Deputy Director and Head of Quality Improvement in Improvement Cymru. And with me today is Margaret Rennox, who's the cohort lead, and also David Maxwell, who's Principal Educator in National Education Scotland. But we will go through that in a little bit more detail. I'll get everyone off their mics and introducing themselves shortly. So Teams seems to be working, fingers crossed. I shouldn't have said that, all right, touch wood. Okay today, and everyone seems to be in, and there doesn't seem to be much and nothing in the chat that people are having any issues. But if there are any technical issues, we've got our colleague Sue Loisas with us today, who will be able to pick up those. She's going to be doing all the background stuff and working through breakout sessions and things like that. So if you do have any technical issues, please email Sue if we can't solve them very quickly. But as we go through this morning, touch wood, things seem to be working well. And as I have said, all our shorter modules will be recorded. So this will help you if you want to catch up or refresh any of the learning points. I think particularly for module 1, because this is quite a setup, there's a fair bit of information that I'll be going through today, and you may want to just recap on some of the elements. So these shorter modules will be recorded. Full day modules obviously won't, because we'll be in person with each other, and this will include the session recording and the slide set as well. So you don't have to necessarily listen to all my preamble. You can just skip through to the main information on the slides as well. And they'll be on the Teams channel. So hopefully everyone's managed to navigate to the Teams channel. You know where all the information is. Margaret will be helping us look through that a little bit later on, and it will be in the folders in those Teams channels. So all the information that you need for these sessions will be in there. So this is a good guide, but then I'm going to say I haven't got a USB connected headset, unfortunately. I've had a number of issues with these, and I'm still waiting for a new one to come through from work. But when connecting to your laptop, can be preferable to use that USB, because it does actually maximize your connection and helps disable background noise. My dog is calm, he's old, he's calm, he's used to me chatting away. Sometimes if I do shout hello to you quite enthusiastically, you might get excited, but I don't have too much background noise here, hopefully. So and it's of the time where the kids are out and everything's wonderful. So I am in future sessions, I may be in the office though, just to make sure. So we're going to go through today's session, the objectives. We're going to talk a little bit about our introductions. I've mentioned already, we've got the faculty, but we're also going to look at some introductions of you guys as well, because it's quite tricky to meet people virtually for the first time. So we're going to spend a little time in small breakout groups, just meeting each other. We're going to work through the programme overview. I'm going to talk a little bit about the support that you'll get through your 10-month journey, a little bit around the project as well, and then towards the end we'll go through, if you like, your to-do list. So what are the key bits that you need to pick up between now and our in-person event towards the end of the month. And as I said, we will have a little break in between as well, so you can have a stretch, because it can sometimes be a bit too much being virtual for too long. So we do have some rules that we like. Online meeting etiquette sounds a bit better than rules, but there are some rules that we like, rules to engage, if you like, and particularly when we're working in this virtual environment. So if people can have their microphones on mute when they're not talking, it'd be great if you can have your webcams on where possible. Obviously, if there's any issues, please just switch those off. But if you can have your webcams on when possible, that's brilliant, because it can be a bit daunting to just speak to some black screen. as opposed to seeing some nods and smiles around the screen as well. If you can use hand icons, so if you want to speak, pop your hand up, and any questions or thoughts, please pop those in the chat box as well. We will be starting on time. As you said, I started right at the top of the hour. As sessions are being recorded, if there's any issues, you can be able to catch up on any bits that you've missed, but also breaks as well. We'll make sure we're back on time for breaks, and that makes sure that we finish on time as well. If you can, try and not distract yourself with any notifications, so any sort of email popping up, things like that. For some of the sessions, we will be using Slido or other interactive approaches. So if you've got your phone near you at some point, that would be helpful. We won't be using that today, but in future sessions we will be. And if you have raised your hand or popped a question in the chat, I've got a few screens to look at, so just please be patient so I can get around it all and make sure we're managing the interaction really well. So are there any other ways that we would like to work as a team? Is there any other sort of, pop them into chat if there's anything else you can think of that you would particularly like to add in there as our sort of ways of working together? Any thoughts, guys?
In general, Dom, or just regarding
Yeah.
the ScIL?
Yeah, Lee, in general. Thanks, Lee. Great one in collaboration. Learning from others. We have got, you think of when you start meeting each other, you'll see we've got quite a diverse background, diverse range of skills and expertise and experience across the whole of the cohort. So learning from others is going to be an absolutely crucial way of how we work together. Mutual respect, thanks Sharon, absolutely essential. How we build off each other's learning is really important. So supporting each other. Improvement can be a scary journey together. It can sometimes feel a bit isolating as well. So I think that's really important, how we support each other, and how this cohort becomes that network of support as well. Fantastic. Please pop them in as we go through if there's other ones that you reflect on, and we'll pick those up as we go through today's session. Thank you. So we're going to begin by introducing the faculty to you, and then we'll get to know you guys a little bit more as well. So I'm going to start. I've given you a little bit about myself, so who I am, not really about my background though. So I'm Dom Bird. I started in the NHS, oh my goodness, 20 years ago this September, I think it is. And I started working in improvement pretty much straight away, but it was where I was living at the time was down in South England. I moved to Wales then, and shortly after that, and started working within improvement training in Wales from then. So I've been working in the NHS in Wales for a good number of years at a national level, but also working within support and health boards as well. And yeah, my background's non-clinical. It's largely around improvement, capability, project management, and those sorts of aspects. So that's myself. I'm going to hand over to David next, introduce himself and give you a little bit of background.
Thanks, Dom, and it's a pleasure to meet you all. I'm very much looking forward to meeting you all in person in a couple of weeks' time as well. So I work, as Dom said, for NHS Education for Scotland, but Australian born and bred, and moved over to Scotland 13 years ago, and have been working in improvement for around 20 years as well. completing the IHI Improvement Advisor course back in 2014, and have been doing education in terms of training and teaching and quality improvement for the last 6 years or so. And I've had the pleasure of working alongside Dom and Gethin, who I know isn't here today, but in terms of delivering a previous couple of cohorts of ScIL with Wales folk as well. So it's just a pleasure to be here. So thanks, Dom.
Thanks, David. And we also have with us Margaret. Margaret
Hi,
Lennox.
everybody. Lovely to meet you. I'm looking forward to seeing you in person in a couple of weeks too. So I trained as a registered nurse 42 years ago. And I know it makes me feel really old when I say that. And I spent about 20 of those the last 20 years working in improvement, and probably about the last half a dozen or so involved in QI training. But I now work as the academy lead in Improvement Cymru. So I'll be your cohort lead as well as the newest member of the faculty. So I'm not delivering any training for the first few modules, but you'll see me delivering some training later on as the course progresses. So all things kind of operational, then I'm the person to come to. But we'll talk about our roles a little bit more later.
Brilliant, thanks, Margaret. And not with us today, but you will see him in person in a couple of weeks' time, is Gethin Pugh. So Gethin is the lead faculty. Gethin is an intensivist by background, so he works within Swansea Bay Intensive Care. And Gethin's been involved with improvement training. I remember he approached me. I was setting up the academy a number of years ago. I think it was 2013. He was a newish consultant then, interested in improvement, thought there was something in it, and is there something we could do with a few of his intensivist colleagues? And yes, before we know it, that's where his trajectory has gone. So he's still got his clinical role within Swansea Bay. He's lead faculty for us in this ScIL programme. He's also the clinical lead within the academy. And he also works within HEIW in their quality improvement skills training as Associate Dean. So you will meet Gethin in a couple of weeks. Many of you may have already met with Gethin or have known him in his various roles across Wales. So now we're going to turn over to you guys, and it's your turn to get to know each other. So we're going to get you into random groups of 3. And Sue's going to help us out in the background with that one. And I want you to just share with each other who you are, what you do, and one fact that you would be happy to share with other people. So we'll give you 5 minutes in your first random group, and then you'll come back into the room and we'll have a quick chat, and then we'll go back into another group for another 5 minutes. So Sue, if you can send them off into their random mixes. So who you are, what you do, and a fact.
Yep. Okay. Rooms are opening now.
Folks, it doesn't when you jump into those rooms, it goes very quickly. But we're going to have another round in a minute. But before we get there, so I'd like to get a couple of volunteers who are going to share who did they meet and what was the fact, if you can remember any of the facts. So anyone want to put their hands up or come off mic? Who did they meet and what was the fact? Go, Lindsay.
Yeah, hi everyone. So I met Kath, and she's also known as Kate. She's an OT with Cardiff Vale, and her interesting fact was that she's got 50. And I also met Leanne as well. She's lead nurse for neonates, and interesting fact was that she's a Neighbours diehard fan, and she can't wait for it to restart in the autumn.
That's brilliant, thanks, Izzy. We got the second fact. The first fact we didn't get.
Oh, it was Kate had 50 houseplants.
50 houseplants. Oh my goodness.
Yeah.
Wow. I have like 10, and that becomes a saga to try and remember which. Good grief, fair play, Kate. Okay, and love the Neighbours. I sadly admit I did cry. I did cry. Who else? Who else have we got? Else has got Tom. Do you want to come in?
Yeah, so I met Toya and Shub. Toya is manager of theatres in Aneurin Bevan and Grange and Neville Hall. Shub, as you know, is an anaesthetist. But the interesting fact was they're both martial art experts. So Shub
wow.
is instructor level in Kung Fu and Toya a black belt in kickboxing, whereas I am sadly only a black belt in watching TV.
Oh, fantastic. Well, that's brilliant. Okay, it's slightly terrifying, I think. But no, brilliant, excellent. Okay, so we're going to go back into random groups. You've been mixed up with other folks now, and it's a really good opportunity because you're going to meet. Obviously, there's be a coaching group that you're going to get to know really well, but just so that we can warm up a little bit before we see each other in a couple of weeks. So Sue's going to open the rooms again. If you're ready there, Sue, do you think? We should be able to go into our next groups.
Rolling then.
Welcome back, everybody. So we got any volunteers for one? Let's see, we'll get one more fact out. Angie?
Thanks. Thanks, Dom. I was in a group with Samantha Scott, and we actually went on a tangent talking about sepsis, which is something that
Oh.
we both love
Yeah.
working with, and something that we're both working on. But then finally, before we finished, Samantha said that she has a snake, and that's a fact.
Oh, wow.
I'm afraid of snakes.
I'm glad this is virtual as well.
I'll be bringing him with me. Joking, everyone, joking.
Oh, wow, Sam, didn't know that one.
My
Heidi, did you?
sons.
Oh, it's your sons, is it? Oh, gosh. Heidi, did you put your hand up as well?
I did. I was just going to say I got to know Farouk in this room, and he's previously been in hospitality and worked on all the cruise ships and has been on the QE2 and travelled around the world twice.
Oh,
And
my
I was
goodness.
mystified as to why you would give that up for the NHS, but it was a case of needing to settle down. So
Fair enough. Fair enough. I think we'll all be, yeah, slightly mystified by that one. What a fantastic experience. Okay, excellent, everyone. So we've got to know each other a little bit. We're gonna obviously you're gonna have lots more time getting to know each other in the sessions in person in a couple of weeks. We have just had a quick chat around the sessions. We're going to have a photographer there. I just want to mention this now to folks, and we will put this in the team. So for those that can't make it today, make sure everyone's aware. But on day one, we're going to have a photographer there just to take photos of some of the activities for some of our resources that we use in the academy and things like that. So if you don't want your photo taken, please just let us know when you come in on the day. We'll make sure that you don't get in those pictures. But there's no kind of you don't have to be completely dressed up. We're still going sort of comfortable wear for workshops and sessions, but just wanted to make you guys aware. But when we're together, you're going to get to know each other so much better and beyond your coaching groups. But it's a good way to just start us off initially when we meet virtually. So we're going to have a look now at the actual program overview, spend a bit of time on the program, and then we'll go through support your project and to-do list after we have a short break in a bit as well. So if we think about the aim of ScIL, it is about how do we develop individuals who can design, develop and lead improvement projects and generate support for change and provide that expert improvement support and advice. So our objectives are to give ScIL learners in-depth understanding of some of those improvement science concepts, those core concepts, the ability to apply improvement science thinking and techniques as well. Also the skills to lead and manage those improvement projects, as well as facilitating and learning and coaching individuals and teams in improvement science. So it's quite a rounded approach, and it is about how do you lead and support others within their space, as well as getting to grips with all of those core contexts in quite an in-depth way. I just wanted to have a little bit of a pause there, and if people can pop into chat, where do you think how would you rate your current level of knowledge and experience and improvement? So is it some experience? Is it I can apply it, or actually I can lead improvement projects? Where are we across the cohort? So if you can just pop that into chat. Where would you rate? Apply it, excellent. Thanks, Heidi. Some experience, Toya, brilliant. Right, excellent, excellent. Leading experience as well, brilliant. Some experience, starting to apply it, excellent. Led previously, brilliant. Thanks, Julie. Tom, really good point, depending on scale as well. Developing knowledge and a knowledge base and applying it, brilliant. Some experience. So you can see we've got a wide range across the cohort, and that's fantastic. We'll have where we can support each other, and this is what we talked about earlier in some of our ways of working. How do we use the experience and the expertise across the cohort as well to support each other? So that's fantastic. So we're going to be looking at the whole improvement journey, and we'll be taking you as learners through this whole journey, from creating those conditions at the beginning, which is about how do you build the will and the conditions for change, through understanding systems, developing aims, testing changes, but also then looking at implementing and spread. And underpinning each of these stages is looking at leadership, project planning and management, and communication and measurement as well. So this is the driver diagram for the ScIL program, if you like. So this is the theory behind the program. So our ambition is about how do we, as we mentioned, developing individuals who can design, develop and lead improvement projects, generate support for change and provide that expert support and advice. And to do that, there's three primary drivers and related secondary drivers that we have. So one is around that program content, which is support participants to develop improvement expertise. So that's about that deep understanding of improvement science and also how to lead and manage change for improvement. Second is about how we deliver the program delivery approach. So we've developed this to maximize learning. So it's very much adult learning approach, encouragement and self-study. It's a practical approach. So it's learning based around improvement projects and the networking opportunities as well. So drawing on the experience and expertise across the whole of the cohort. And then lastly, about the participant commitment and application within that organisational support as well. So it's that planning and resilience, that personal responsibility, how the leaders in the organisations ensure that there's resource and support for the project, and that you are actually able to dedicate at least one day a week over the year to this work. So this is our theory of change, if you like, around the ScIL programme. Now, over the course of ScIL, you'll go through the stages of understand, apply, lead, and provide some expert support across the 5 key themes of ScIL. And these are the sort of key areas that we'll be looking at. So systems thinking, building knowledge, leading and managing improvement, measurement and planning of improvement, all designed to support you to become an improvement leader. And each time we come together over those modules, we will be building on each of these 5 areas covering specific topics. So you can see in some of these, we have the systems thinking, we've got tools to understand your system, population segmentation, reliability, human factors. If we're thinking about planning for improvement, at some stage we'll be looking at planning for implementation, scale up and spread, logic models, etc. So you can see how we will build on these 5 areas each time we come together over those modules. And as you know, ScIL is a 10-month programme, so that will provide many different opportunities for learning and interaction. There's a mix of live learning and sharing, QI coaching sessions in small groups, which I'll talk about a little bit more detail in a bit. There's facilitated chats in the general channel, so please use the general channel on Microsoft Teams on topic scenarios, as well as the coaching groups and self-directed learning as well. You'll be asked to complete some pre-recorded content, so Module 2, for example, specific activities, complete short quizzes and reading of core texts as well. And these are just as important as the live learning that we do together. And the self-learning activities will assist with some of those live discussions and activities as well. So there's 2 core elements of ScIL that are designed to support you learning by doing, if you like, getting your hands dirty. So you'll each be leading and will be expected to apply a range of tools and methods that we'll be learning about to your project. And it's how you're learning in more in depth about those tools by applying them through that QI project. Sitting alongside your project activity will be your evidence portfolio. So this is your opportunity to demonstrate how you've applied your learning, and we'll touch on this in a little bit more detail shortly. So everyone will have an area of focus for their ScIL journey. So what else do we expect from you? So please do attend all full day modules. So the in-person modules. Only in exceptional circumstances, unfortunately, will be considered if attendance is not possible. So not necessarily annual leave or work-related commitments. We know that there are some issues that do crop in at last minute, only in exceptional circumstances. And if you can contact our cohort lead, Margaret, if there are any issues. If you're unable to attend, we could look to move you to another ScIL cohort. Try and attend or catch up on all the other modules. On rare occasions, if it's not possible, we do have obviously the recording, etc. We have our monthly reflection logs and evidence portfolios. There will be requirements for things like project charter, drive diagram, measurement plans, and PDSA. And participate in the QI coaching small groups as well. You also have the poster presentation and the action slide, and the next few slides will go into some of the above in a bit more detail. So this is an outline of what you will need in your evidence portfolio. So the technical tools that you've used, project charter, driver diagram, measurement plan, PDSA, action plan, and your poster as well. And you'll get a chance to share each of these elements in small groups and get feedback from your mentor prior to finalising and uploading to Moodle. So there are templates for each of these on the Moodle system, and there's also specific submission dates for each element that are outlined in your participant handbook. So the dates are based on supporting you to progress through your project over the 10-month period. And you will be developing and refining using these, sharing with peers and incorporating feedback. It's a very iterative process, and you've got support from within your coaching group, but also within the faculty and the mentors in your organisation. So as part of your learning, we'll also need to look at maintaining and submitting a monthly reflection log. So these need to be submitted by the 15th of the month, and these are key to your ScIL journey. So over the cohorts, we've refined these into now what we call like a flash report format. So the template is on Moodle, and the purpose of the reflection log is to enhance your learning. It does give you a chance to reflect on your learning and from carrying out your project in the workplace, identify any learning gaps and emerging issues. It also supports us as faculty with some of the evaluation to understand if the programme is meeting your needs, if there is adjustments that we need to make as well. And there is guidance in your participant handbook on the monthly reflection log. And as said, both the template and the guidance on how to complete it are also available on Moodle. And essentially, these are the sections of the log that you'll complete. So the project aim, the activity, what was undertaken, what was planned, what your change ideas are, PDSA ramps, measures and charts, and risks and issues, and your learning as well. So looking at your reflections on your theory and into practice. So at the top section of the reflection log, there's a box to add in your self-assessment of your project level for that month. So please complete that and ask for feedback from your QI mentor if they don't agree on the scoring, for example. Not only does it allow you to reflect back on your progress from your first to your last logs, it allows us as faculty, again, to ensure that our teaching is developing your skills and enabling your work to progress. So thinking about where that score is, where your project progress is, whether it's, well, we're looking at understanding the system, or actually now we're into testing underway. And you'll also be allocated into QI coaching groups. I think most of you have probably seen that within the teams already. And in those groups, each coach will have a coach from our faculty. So in these groups, you'll be presenting your developing improvements. And through that all teach, all learn approach, we'll be coaching each other on your improvement journey. So this is very much a safe space, and lots of learning happens within that space. It's a locked channel for each group in your team as well. So there is a separate area for each of the coaching groups to have those conversations, and we'll have some dedicated time together as well. So the groups are about up to 8 people, and they're led by 1 member of our faculty. We meet for an hour 4 times over the course of the programme, and it's linked to some of the shorter modules. And in each session, we'll have 2 spotlight presenters to help start those discussions and get feedback from your peers and the faculty members. So it is a very all teach, all learn approach. Each coaching group has a lock channel, as I've mentioned. So that works. It works really well. It's a very supportive environment. The spotlight presentations can seem a bit daunting, but it's such a supportive group, and there's a great deal of learning that people gain from that, and development, not just for those that are presenting, but also for those that are supporting as well. So each of our sessions together is themed, and the first coaching session will be as part of module 7. We'll be focusing on understanding our system. The second then will focus on how we're developing our change theory and how we can describe that using a driver diagram. And the third, we'll be looking at measurement plans, and finally a session looking at data over time. So each of these key elements will be coming together in our small coaching groups and exploring those themes together, looking at the projects and the pieces of work that you guys are involved in leading. So these are the coaching groups that we have established, and you'll be part of the private channel for that coaching group with the faculty lead. So in that private channel, you have access to the coaching dates and presentation schedule. So that is who's going to be spotlighted in your group for each session, and we'll provide more details about the coaching sessions as we get closer to module 7. So then the last part of the programme requirement is the completion and submission of your poster and action plan. So the purpose of the poster is to summarise your QI project and your learning, and it's to be submitted roughly about 6 weeks after your final module. We'll have definite dates, and you'll get all of this detail as we get closer to the time as well. There is a template for you all to follow, and guidance on the Moodle page. So all the previous posters as well are on the QI zone. But we'll send you through some of the good examples nearer the time, so you can see the sort of approach. And we will have our graduation event, which was so fantastic. The last graduation event, the last cohort, being able to bring people together for the first time in person was fantastic. So at the graduation event, we will print those out for you, and you'll have them all up. And Nez will publish them as well on the QI zone, and we'll publish them as Improvement Cymru on our resource library as well. But learning doesn't end after those 10 months. So we'll be asking you to think about what you'll do after ScIL, what's your action plan, and also more details provided on the duration of our time together at ScIL as well. So I'm going to take just a very quick pause and see if there's any questions? Is there anything there that people want to go into in more detail at this stage? Any questions, any queries? Lee?
Yeah, just a quick one for me. I've tried, who's the best person to see about the Moodle access? Because I've tried accessing a couple of times and it's not allowing me to with the username recommended and the password.
Okay, so Margaret, if you pick that up with, yeah, that's brilliant. Thanks, Lee. If anyone else has got any issues like that, if they can let Margaret know and she can progress those with the relevant people. That's brilliant. Any other questions, queries at this stage? Lindsay?
Just want to know, with the 4 sessions we have together with our coaches, the 2 spotlights we have for each 4 sessions, will we get allocated, when we're going to do our spotlight? We'll get allocated which one?
Yeah.
Okay.
Yes, you will, Lindsay. Yeah, and it won't be like, right, come on, Linz, you're on now. Yes, you will do.
Okay, perfect. Thank you.
And as I say, it's a good safe space for you guys to share how it's developing at the moment, where you've got to, and it's incredibly supportive. I learned so much from the coaching groups as well. I have my resources next to me as well, so it's the skill journey never ends, if you like. I always have all the resources around me, and I'm like, all right, okay, and then bring in the people in. So it's a very supportive area, and it is very much all teach, all learn. Excellent. Okay, so I think we are if things come up, don't worry, we'll have some time for some questions at the end as well, but I'm going to give us a little break now. We've been together for nearly an hour, so let's have a 5-minute break. So go and stretch, get yourself a drink, and hopefully if you can, just quickly nip out, stand in the sunshine, and we'll be back in 5 minutes. Excellent. Thanks all. So I think we got about 7 or 8 minutes there, so that's not too bad. I thought it'd be easier just say back on the hour rather than trying to work out specifics. I remember running a course with, I think it was when I was doing the helping out with the IA course, and they were very specific on breaks. So if it was 10 minutes, it was exactly 10 minutes, which was just round it up. It's a lot easier for people. So we're going to now get into looking a little bit about the support that you'll have on your learning journey, building on each of those concepts throughout the course schedule. So we'll look at QI Mentor, the organisational support as well. We'll look at Moodle resources, and other cohorts have actually set up a WhatsApp group to network and share with each other as well. So that may be something, I don't know if that's what you've already done, I'm not sure, but it could be something that folks want to do. We'll go through that. Then we're going to do a little bit around the project and then the to-do list as well at the end. And as I said, you'll have all these slides as well afterwards, so you can recap at your own leisure. So our support structure looks a bit like this. So you've got us as the role of ScIL faculty. We're there to provide the training throughout the course, assess and support you through your project submissions. You've then got your ScIL coach. So that's in those coaching groups, and that's to support you through the tasks that will be set for those coaching groups. And then you have your QI mentors. So these will be within your organisations largely, and their role is to feedback on your improvement charter and other specific tasks. They can feedback on your monthly reports. They're like the go-to person for improvement advice within your organisation. And in addition to that, you'll also have the support, obviously, of the cohort lead, Margaret, for any operational issues as well. So this, I'll go into, this is our monthly reflection log process. So your QI mentor will then respond to their respective learner with feedback, and you need to let your cohort lead know if there's any mentoring issues early on. So to ensure you're getting any up-to-date relevant feedback, and your first report will be due on the 15th of July. Please make the most of your mentors. So you should have details of your mentor. Please contact us if you need this clarified at all. It's up to you to make that contact with your mentor and optimize that resource. I agree with them how you want to feedback, if you want to have follow-ups by phone, if you can meet face to face. When I went through this process, when I did the IA course a number of years ago, I scheduled them in regularly, and once I had my sort of submission dates, etc., I scheduled them in well ahead, and just to have those touch points, but those feedback sessions is really helpful. Margaret will be checking in with the mentors at regular periods throughout the cohort as well, so that they know sort of where we are in terms of the training program, which stage we're at, etc. But reach out to your mentors and get those dates in as soon as. It's always tricky to try and do those at short notice. And there are a great number of resources within the QI zone run by Nez on Turus, but there's no need to register. These are accessible to everybody. These are suitable for a range of staff. There's introductory modules through to others that aims at those that leading quality improvement projects. So I don't know if is anyone pop your hand up or give a wave if you've managed to have a look at any of those resources yet. Do go and have a scout around. There's some fantastic resources there. There's also resources available on the Improvement Cymru Academy library as well, and those resources will be developed further through the programme. And Margaret and the team will be sharing those links as they become more populated as we go throughout the programme as well. So there's a lot of resource and support out there, and we can direct you as well to specific areas if you're finding any challenges with specific topics. So I'm now going to hand over to Margaret, who will talk you through a few key points from the admin team viewpoint. And Margaret, do you want me to do you want to do the old next slide, please, and I'll click through?
Yeah, sure. Thank you. It's a lot easier than technically moving the slides over. Yeah, so all of your queries will come through if you can use the generic Improvement Cymru Academy inbox, which has previously been on the slides, and that's the one that you've used before when you've liaised with us. And the reason for that is that there are 2 members of the team who you'll get to meet on module 3, 4 and 5 as Chris and Jodie, who will be manning the inbox as it were, and they will respond in a timely manner to any of your queries. So that's much better than thanks Lee, than somebody trying to get hold of somebody individually, because of course we will all be on holiday at some point in the coming weeks. Next slide, please, Dom. So you should have received information about getting into Moodle. I can see that I've had emails from a couple of you who are having some problems, so we'll get that sorted next week. And you have, as Dom has mentioned, you've got a Teams channel which is specifically for the learners. So all of the information that we've circulated to you so far is on the Teams channel in the files section. And at the end of each module, we will upload any relevant information that you need to access. So there may be a couple of days delay because some of our team work part-time, but it will take no more than a few days to get any information onto those module folders. So anything from today will go into module 1 folder on the Teams channel. And then in addition to the generic Teams channel, you will have your coaching groups. So the Teams channel is where we will add all of the learning materials from the training. Moodle is the platform that you will use to upload all of the documents that Dom has gone through, including the monthly reports, project charter, driver diagram, your poster, etc. But we will keep reminding you just to try to avoid any confusion. But you know, in these early days, as we're getting to grips with things, please ask. We don't mind if you don't feel silly by asking questions that you think you might have already been given information about. Just ask rather than be confused. Next slide, please, Dom. So when you email the Improvement Cymru Academy, if you can just use the subject line ScIL Cohort 44, because our very clever team have set up a folder where your emails will drop straight into that folder and you're more likely to get a timely response. Next slide, please, Dom. So we've given you a list in your checklist document. Again, it's on the Teams channel in the folder. We've given you a checklist with all of the deadlines. The key thing to remember at this point is your next monthly report is due on your first monthly report, should I say, is due on the 15th of July. We will send email reminders in advance of all of the deadlines, and we will send chasing emails the day after the deadlines, and then we'll be getting you'll start to get some grumpy emails when things start to get really late. So that's how the deadlines will work. Next slide, please, Dom. You should have all responded by now to the quest back email, which has come directly from the NES team. If you, we know that a couple of you have had technical problems with your IT support not allowing this email through, and you've chosen to use your personal email just for quest back. So please let me know if anybody has any ongoing problems or you've not had the opportunity to return that. I know we chased the last two of you this week, but if there's anybody else that we've missed, please let me know. It's really important that you have completed that as requested, because we will be discussing it at the end of the month when we come together. Next one, Dom. And I think that's back to you, Dom. Thank you.
Thanks, Margaret. So please do reach out if you've got any issues with any of the deadlines, give us a heads up ahead of time so we can support you. But please do reach out on that email address and use the ScIL Cohort 44 aspect. That's fantastic. Okay. So let's get started. Let's look at the project. So your project will be your opportunity to get your hands dirty and apply your learning. And to nurture your project and allow it to grow, we do recommend 1 day a week of dedicated time. So you may need to discuss this with your organisational mentor if this isn't happening. Do pick this up with your lead faculty as well if this is becoming an issue. But it will take time. It is about one dedicated day a week. So your project, if you think about it, needs to be something that you can influence, and you need to be clear about how it fits with your organisation's strategy. So you'll need to be doing the doing, getting your hands dirty with the team, and of course, applying this learning over that 10-month with us. So you need to find a project that is the right scale and the right scope for a 10-month programme. You are not going to get world peace in that time. And I know that many of our learners, you will be maybe working on large national or organisational level projects. And it will be thinking about how do you strip that back or identify a chunk that you can work on to ensure your project is manageable. So think about your scope. If you've got a massive driver diagram, maybe just focusing on one part of that system or one driver as a starting point. And think about the scale as well. So starting with, say, one ward, one area, one department, trying to use that down. And it's not to say that you can't use the QI methods for larger scale change. You absolutely can. But thinking about the time scale that you're with us, we've got 10 months together. You'll need to identify a suitable project or part of a larger project to be your ScIL project. And we can help you scope that through too. So therefore, we might need to continue to scale down to have small enough project that shows that you've applied your learning over that 10 months. So has anyone at this stage thinks that you might need to reduce the scale of your project? Put your hands up if you think you might need to reduce the scale of your project. Oh, Andy?
So talking to my coach, where I was changing my project to improving the readership of the Q Cymru newsletter. And then speaking with my coach, he would like to see if, well, can we just expand that to improving the Q Cymru network? So, so obviously, just with the pandemic and everything else going on, I know that Q are facing that issue anyways as a UK sort of organisation. So I'm still thinking about it because I think there is some things we could do. But at the same time, 10 months, where I think that could take 18 perhaps.
Yeah. So that could be your overall, is about how that network, and it could be you're focusing on one aspect of that, as you say. It could be the interaction, it could be the news, etc. Thanks, Andy. Andrew?
I have been working on a few projects in my current role, and the one that I've submitted for the application, I'm changing that actually, because that's been achieved in a different way. And I wanted to reduce scope and something more specific. So the project will be completely different from what I originally submitted, if that's okay.
That's fine. That's fine. And as we get into this, you know, it's how it can support work if you're already doing, which is fantastic, but it's making sure that it's at that right scale. So that's fine. And we do have a number of projects. There's a kind of a cut-off point where we have to kind of just go, you got to go now. You've got to go with it. So, but at this stage, that's fine, Manju. Don't worry, that's fine. Any other anyone else want to share if they think their project is, they might have to scope it down? We'll have plenty of opportunities to discuss this through in our groups, but also in our sessions together in a couple of weeks. So thinking about the pieces that we'll be looking at, the first thing we'll be looking at is your improvement project charter. And this helps you fully understand the why, the what, and the who of the project. So if you think, we'll be looking at our aim, the rationale and the scope of it. Considering what are the sorts of measures, so where's your baseline, what demonstrates that that's an issue, how are you going to look at your improvement, how are you going to capture that learning through your measures over time. Considering early stages, what are some of the change ideas, but also the activities, and not forgetting the team and the leadership as well, so the who. Here is the reference to the improvement guide. There's a fantastic piece around project charters, page 89 to 100. And we're going to go through each of those sections of the project charter, starting with the aim. So over to you to get your initial thoughts. Please type into the chat box or raise your hand, whatever suits you guys. Why is it important to have an aim statement for your project? Why do folks think it's important to have an aim statement? Give it direction, yeah. Smart approach, communication and clarity, yeah. Aligning the team, absolutely crucial, yeah. Clarity, focus, clear understanding of what you want to achieve. Clarity and framework. That's really a helpful consideration, the framework for the entire project. Giving that direction, yeah, fantastic. So there's a lot of aspects in there around the clarity. And how many of you have been involved? If you just put your hand up or give a wave. How many of you have been involved in developing aim statements so far? Yeah, quite a few. So anyone want to share an experience? What's your experience been? Does anyone want to keep their hand up and share an experience of what it's like? Joe? Is it Joanne or Joe?
Joe is fine, actually.
Joe. Okay.
Yeah.
On, Joe.
Yeah, I've had some experience of trying to communicate the aim of the project that I have been leading recently, and that in itself has been a challenge to keep the communication channels open, and for everybody to understand and to know about it. So that in itself was a big challenge.
It is one of the crucial aspects, thanks Jo, communication, and it's continual as well, isn't it? It's not like, right, we've done that, now move on. It's just continual. Thanks. Julie?
Yeah, I think my experience is that when you ask people to do an aim statement, they say, oh, we want to achieve this by doing this. And it's trying to explain to them that, you know, try and understand that, you know, you don't want to jump to solutions at this stage. It's just to understand what you want to achieve. And you need to do, obviously, you know, understand the problem so that you're not trying to solve a problem that doesn't exist, if you like. So I suppose it's just keep trying to break it up really and trying to keep it on track and not stop people going off in lots of different directions.
Brilliant, thanks, Julie. And that is a common, as you say, is a common jumping straight into the change that we're going to make, as opposed to stepping back and going, what are we trying to achieve here? Tom?
Yeah, I think I've had some experience in the past, particularly with complex improvement aims that involve a lot of different professionals, or perhaps an executive sponsor who, it was really important to have that clear aim statement at the beginning, because somewhere down the line, perhaps perceptions changed about what this was trying to achieve, and actually having that, you know, that actually we all agreed that this is what we're trying to achieve. So you know, I think having that sorted at the start ensures you have consistent commitment from everyone involved about what you're trying to achieve.
Definitely. Thanks, Tom. Kate?
Yeah, I was just going to mention that I found it a challenge sometimes when writing an aim to kind of give that how much by when specifics to it, because sometimes you kind of think, oh, we'll be setting ourselves up to fail with kind of going quite, I don't know, ambitious, I guess, with it, and knowing what's a realistic kind of where to pitch it really is what I found a little bit difficult sometimes.
It can be tricky, Kate, and that's a really interesting, because you want to stretch, you want to be able to be ambitious. But often the culture in which we work is very target driven, and so teams can feel uncomfortable in stretching that aim, because, you know, this isn't about improvement and learning. It's almost working in a culture of performance and assurance. So it can be difficult for teams to feel confident enough to say, this is where we want to eventually get, and we may not make it there, but this is where we are trying to get to. So it's how do we support the teams in having that comfort and understanding that this is an improvement and a learning journey. Thanks guys for sharing your reflections. Baruch?
Thanks, Tom. Yeah, in my experience, like I've been working on a false collaborative, and it was really very important to narrow down, like, or make your problem statement clear first, so that you can create a proper aim statement, because we've been going back and forth. Is multiple falls the actual problem, or is it overall the falls the problem? So yeah, it was, so having a clear problem statement first, then you can then create your aim statement based on that problem. So.
Excellent, thanks for it. And your aim can drive behavior as well. So being clear and thinking about, well, what is the team going to chase, if you like, with this aim statement? It's really making sure the whole team is involved in developing that. So thanks for all that feedback. That's fantastic. And I think you've covered most of the pieces that we've got here. So just as a sort of recap, it does provide that framework to think through all aspects of the improvement project, to help you go back and check in, as a few of you mentioned. I think Tom mentioned that. It keeps improvement activity focused. So a lot of you talked about that focus, the scope creep, the clarity, so it keeps it with where other stuff can start trying to lead you astray, perhaps. It does keep makes clear the scale of the improvement expected from that project. So there is that balance, and I think Kate mentioned that wonderfully, that balance of how do you keep realistic but stretch your team as well, so it's how they feel comfortable in where their ambition wants them to go, but we're not trying to solve world peace. And it helps you actually to get the team membership right for the improvement work as well, because it can work as a really good check-in around, well, to do this, have we got the right people involved here? And is there anyone we're missing? And sometimes that stakeholder piece we do tend to miss. So it's always helpful to go back and check through the stakeholders. Communications, absolutely crucial, and a few of you mentioned that. Making it as easy as possible for everybody, including those senior leaders, to understand what we are trying to achieve. And thinking about the communications from the beginning, so the what, why, and when. And the aim is that single sentence that describes how good you want to be, by when, with who, and where, and what. So it's that balance, as we said, about aspirational, but also achievable. And it's about how do we make that challenging for the team, but just not too much out of reach. So it is a real balance, and you'll feel that and get that sense from the team as well. So we've talked a little bit about your clear aim statement, that what, when, who, and by how much, how it should focus on the outcome. So what exactly are we trying to achieve with this, not the change, as I think Julie mentioned as well. Often it sometimes creeps in that we're going to do the activity as opposed to, well, what are we trying to achieve? And how do we share and communicate and manage expectations through that? But to recognise it's not always right first time. So as you learn more about your system and understand more about your system, about your baseline, etc., that we can recap and review our aim statement as it's progressing. So we've got some of aim statements here, and some of these maybe don't include the how they're going to achieve them. So we need to keep the how, or what we're going to do, as that test. And we've talked a little bit about that in our reflections from you guys just now, but we'll cover a bit more of that in module 3 as well. And one of the first things we're going to ask you to do is to draft and share your project aim statement in your QI coaching group channel, just as a way of sharing a bit more detail about your project, and for us to be looking out for the who, what, where, how much, and by when. So as Margaret said, you'll get all these details afterwards as well, but everyone should start posting their draft initial aim statement before we get to module 3 in those QI coaching groups. And alongside your aim, we looked at on that project charter, thinking about the rationale. Why is this important? Why is it needed? So thinking about your rationale and your scope. So why the area important is so important? What problem is it looking to solve? And what's the impact of doing nothing? How do you know that that's a problem? This will help you in terms of that baseline data as well. What is being evidenced that you know that there's an issue? It could be there's that how big is that gap between where you are or where you want to be, and who would be affected by that? So which service users, which group, which area, how many people, how large an area will be affected? We've talked a little bit about that strategic vision. So how does this fit into the strategic vision, the priorities, if you like, for your organisation as well? And why do you think this timescale is realistic? So we're thinking, don't forget, 10 months at this stage. And thinking about that expected impact as well. When we've started working through, how do I know, considering how you know that this is a problem, that can sometimes help you think through into how will you know that change is an improvement. So how are you going to learn about how you're progressing towards your goal, and thinking about the measures that at this stage you're considering to track. And this is an iterative process, so don't try and get it perfect first time. This is an iterative process, so think about what will your outcome be. So how are you going to track the progress of your improvement aim? How will you know the parts of the system you need to change in terms of your process measure? And balancing, is there any other areas that that you need to keep an eye on in case your action has any unintended consequences? So if you look at page 96 of the improvement guide, it covers those 3 types in more detail as well. And then it may be that you've already got some initial ideas that your team has to test to move towards your goal. So what are those initial ideas? What changes? What can you change about how your processes and your system currently operate to make things better? They're included in the next section in some of the tasks and activities. They are slightly different to change ideas and shouldn't be included here. But what evidence is there out there about what works? Thinking about what your subject experts are telling you. And have you conducted any sort of as-is analysis, so cause and effect process mapping that has generated some of those initial change ideas? There's a really good resource within Appendix A of the Improvement Guide, so it's page 357, which has 72 change concepts. That is a brilliant piece, a brilliant summary there, those concepts, and I continually have those next to me whenever I'm doing any improvement work, just as a reference guide. It's very incredibly helpful to have a look through those as well. And then considering how you'll get started. So what initial activities do you have planned? So these are the tasks associated with your project, not to be confused with change ideas. But these are things like setting up your improvement team, gathering your baseline data, starting to understand, apply some of the improvement tools to help you understand how the system's working and start generating then some of those change ideas. So these are like the tasks, not the change ideas. These are the pieces, the nuts and bolts, if you like, of getting your work going. And when you're thinking about who will be in your improvement team, it's really a wide range that you need to consider. So how are you going to engage those team members? But you need to consider is appropriate subject matter expertise included? Are the process owners who can make those changes represented? So think about who's heavily involved in the actual changes that will result those processes, and are they engaged? Because they have absolutely unique views on the system and understanding the system. What about representatives of those impacted by your projects as well? Excuse me. So families, young people, patients, carers, etc. It may be that a finance representative could be appropriate at this stage. Thinking about mapping that out and understanding, involving and include as many of those team members as possible. Then thinking about what those individual roles and responsibilities are within the team. And a key area is a sponsor. So thinking about where is that sponsor link with executive level potentially for leadership support? Has that been identified? So we've gone through each of those elements, the aim, the rationale, the scope, developing measures, the changes, some of the activities, the nuts and bolts of getting the work going, and also team and leadership. And as I said, pages 89 to 100 in the improvement guide, fantastic aspects on project charter. Then we want you to get you started on your charter with the initial focus around the aim and rationale. Okay, so that's the initial focus. And this was a developing piece that will iterate and develop further over time. So add any other thoughts you've got under the other headings as you go, if you've got at this stage. But we're not looking for perfection. We're not looking for it as a whole. We're just looking for those initial pieces. Aim and rationale and scope is where you should be able to get to. And then if you've got any ideas for the other aspects, add those in. And we're picking this up in module 3. So I'm going to pause there for a quick minute. Has anyone got any questions from that? No? Okay. Okay. Don't forget, all these slides will be available afterwards. You can check back through, and you've got the resources already in your checklist, etc., that Margaret mentioned. But do reach out. So there's some other tools that will be of huge benefit to you through your ScIL journey. And one of those is a Gantt chart. So we talked a little bit about the actual project, but there's some project management aspects that can be incredibly helpful. And this can provide you a visual timeline against some of those key project activities and milestones. You can use it to keep track of your learning milestones, your activities and your submissions too. It can should directly link to your project charter and be contextualized based on that as well. So it's most useful when you use this at the beginning of a project. And I'd encourage you all to look at this, doing this as soon as possible. There's a really handy Excel template on the QI zone that you can download anytime. And we will provide you with an example, a ScIL example of a Gantt chart as well. So you can help you populate your own template. But it's a good habit to get into. I don't think it's something that we often use closely with improvement work, but I think it's a really helpful habit to get into. It's just keeping track of all those activities, especially alongside this learning process. So Gantt charts can help you manage timescales, make sure you know when important activities need to be completed. If you're working with a team, it can really help for others to see that as well. And also, if you're going to have to allocate tasks, how you share those around so that people can specifically see their roles and responsibilities, and helps the team to keep that situational awareness of what's happening when and where and how long that project should take, when the tasks need to be completed, etc., etc. So it can be really helpful to scope this out with the team. And then they can see where they are. You can use this as a check-in with staff at key stages as well along the improvement journey. There is more information on using Gantt charts on the QI zone. Thanks, that's a really helpful comment in the chat there about how it can highlight any barriers that your sponsor may need to help with as well. So it can be a really good tool for a number of communication aspects as well. So another project management tool will be really useful for you on your ScIL journey is a lessons learned log. I know a number of people have these already and use reflective logs quite regularly. I try desperately to keep the habit of using a reflective log at least once a week, if not once or twice a week, just to check in with myself around, because there's the ones of my job is I get to work with so many different people in different services across different improvements across NHS Wales, and I learn so much every day. So it's really helpful to capture this and build it into a habit for your ongoing learning in improvement. So lessons learned logs, they're about capturing and sharing knowledge about what's worked well, what could have been done differently during the planning, management of delivery of improvement project. They also help others learn from the project team's experience as well. So it's not just about your personal learning, but it's about how do we share that learning across others that are taking part in improvement journeys. And this template is also available on the QI zone as well. Okay, so now we are coming towards the end, and we're going to talk briefly about your to-do list. And then we'll have time for any other questions and any issues that I've covered that have raised with you guys. So looking forward, let's have a look at our to-do list. So we're going to look at this in terms of project charter, which we've just covered just now. Preparing for module 3 does seem a bit of a skip because we haven't covered module 2, but we'll talk about that in a minute. And the core texts as well. So some of those core text reading. So first off, your project charter. So I want you to focus on drafting that up and share it with your mentor as soon as you can and incorporate their feedback. If you can share your draft aim statement in the chat of your QI coaching group, and be brave, this is a way of sharing a bit more detail about your project and for us to be looking out for the who, what, where, how much, and by when. So to help you do this, please complete module 2. So there is a self-directed learning. Module 2 is video on population segmentation, which will help when considering the scope of your 10-month project. There's also a short video on feedback as well, which describes the model we'll be using as a cohort when giving feedback to each other, and the first being the project charter. So module 2 is those 2 learning resources. If you go to module 2, in the general file to access the videos, and there'll be key questions as well to consider. So they'll all be up there. And Margaret will help you find your way through to those resources if there's any issues. Secondly, then it's getting into the improvement guide. Make this your buddy all along the way. And pages 89 to 100 of the improvement guide, as I've mentioned, they're a fantastic section there. We will also then share with you after this module an example charter. So Project Charter A. We'll share that for you to read and consider what you liked and what could be better. So when we come together in module 3, we'll be debriefing Charter A. You'll have your charter as well. You'll have done your reading, you've done your module 2. Get those pieces done by then. You'll be able to share your draft project charters on our 2nd and 3rd day together in Cardiff as part of our small group presentations. So those are the 3 main chunks, if you like. So we've got 27th, 28th and 29th of June. We're together in person and we'll be focusing on your project charters. We'll be looking at some small group presentations, but we'll have time in those sessions to prepare those. So around improvement gurus. So you'll be doing those in those days. And we'll be looking at core strengths as well as lots of other bits as well. So we've spoken about the project charters, and please make sure you've completed your core strength surveys, as Margaret's mentioned. And if you can have a copy of your report handy with you on module 3, that would be fantastic. Another, whilst I say the improvement guide is your buddy, leading change is also a fantastic resource. So there are quite a few pages in there. So part 1 and 2 is quite a chunk, and they'll be important as part of the leading change activity after module 6. But do start reading through those. They are a fantastic resource. Chapters 1 to 5 of the improvement guide, and parts 1 or 2 are Cotter's leading change. It's helpful to start now and just diving into some of those. But yeah, keep those alongside you as you go through your journey. So that is us in terms of the to-do list, looking at your project charter, preparing for module 3, and the reading. And the real learning happens by getting involved and getting your hands dirty and working on your project. So do get going with your project charter, link in with your QI mentor in your organisation, link in with your QI coaching group as well, and use those connections. Obviously, we've got each other in this, but there may be, and I'm pretty sure most of you will know another ScIL graduate within your area. If you don't know ScIL graduates who already are in your organisations, we can connect you with them. So do reach out to them and make those other connections. It's a wonderful community that will be incredibly supportive to help you through this journey. And it's helpful to have a chat, have a coffee with somebody who's gone through this process and the ScIL process before, so that they can help you. There's a couple of questions that I know have just popped in the chat. Margaret is answering those just now. In terms of the programme start time on the 27th, I'll wait for Margaret to pop that in there as well. Brilliant, thank you. Okay, so today's session, we went through our introduction. So you know all of us, and you've met all of the faculty with the exception of Gethin. Obviously, he'll be there in person in a couple of weeks' time. We've gone through the programme overview. We've covered off the support that you'll be getting through the programme. And do reach out to us if there are any issues in catching up with your mentors. We've gone through the details of the project itself and helping to scope that initially. And we've just recapped on the to-do list. So Are there any thoughts, comments, questions? I know there's a few that have popped into the chat box, so thank you, Margaret, for picking those up as we've gone. If there's any queries that people have, please raise your hand now. Or if you're okay and you know what you've got to do, please let us know that as well in the chat. Thanks, Sue, for that. So Sue's going to let you know all the details of the in-person events. Feeling prepped and ready. Excellent. I see a few smiles, not many, but a few smiles, which is always encouraging. Maybe sunshine. Brilliant. So I'm going to hang around. There'll be a few of us that stay on. We do use Twitter as a communication tool to share learning, as many of the QI community do. So if you want to use Twitter, it's not compulsory, but if you're already on there, here's the other usernames that we use. And if we do want to tweet, this is our hashtag for our cohort. If there's any questions around the in-person events, Margaret will collect them together and get in touch with people individually if there's specific individual questions. In terms of all the other logistics, I know Sue will be in touch with folks. And lastly, I just want to say thank you for all your participation. It was really great to hear from a few of you over this one. It'll be so looking forward to seeing you all in person and getting to know you all in person in a couple of weeks' time. And we will see you in person in 2 weeks' time in Cardiff. So thanks all. Like I say, Margaret and I and Dave will stay on for a minute if there's any other queries to pick up. But if not, please go and enjoy 15 minutes in the sunshine. Take care, everyone, and see you soon.
Thanks, everyone. Bye.
Thank you all.
Thank you very much.
Thank you. Bye.
Bye bye.